Chlamydia is a common sexually transmitted infection, and understanding how it spreads is crucial for protecting yourself and others. The primary way chlamydia is transmitted is through sexual contact that involves the exchange of genital fluids. This means that any activity where these fluids are shared can potentially pass the infection from one person to another, even if there are no visible symptoms. Chlamydia can be spread through vaginal sex, anal sex, and oral sex. It doesn't matter if the sexual activity is between people of the same sex or different sexes. Anyone who is sexually active can be at risk. Even if penetration is brief or incomplete, the bacteria can still be transmitted. Using protection, like condoms or dental dams, can greatly reduce the risk, but it's important to remember that no method is 100% effective. Once inside the body, the bacteria can infect several areas, including the cervix in women, the urethra in both men and women, the rectum, and even the throat. This is why symptoms can vary, and sometimes people don't notice any signs at all. Regular testing is important, especially if you have new or multiple partners. There's a common misconception that sexually transmitted infections only spread through vaginal intercourse, but that's simply not true. Any sexual activity that involves contact with infected fluids can lead to transmission, regardless of the type of sex or the genders involved. It's important to know that chlamydia cannot be spread through everyday casual contact. Hugging, kissing, sharing food, or using the same toilet seat as someone with chlamydia will not put you at risk. The bacteria that cause chlamydia are fragile and cannot survive for long outside the human body. In fact, chlamydia bacteria die quickly when exposed to air or surfaces, so you don't have to worry about catching it from objects or public spaces. The infection requires direct contact with infected genital fluids to be transmitted. Another important way chlamydia can spread is from a pregnant mother to her baby during childbirth. If left untreated, this can cause serious health problems for the newborn, such as eye infections or pneumonia. That's why it's so important for pregnant women to get tested and treated if necessary. Prenatal care often includes routine screening for chlamydia and other infections. Early detection and treatment can prevent complications for both the mother and the baby, ensuring a healthier start to life. By understanding all the ways chlamydia can be transmitted, you can make informed choices about your sexual health. Practicing safe sex, getting regular checkups, and having open conversations with partners are key steps in preventing the spread of chlamydia and protecting yourself and those you care about. Chlamydia symptoms can be tricky as they often don't appear. When they do, they differ for men and women. Women might experience abnormal discharge, burning during urination, or pelvic pain. Men might notice discharge from the penis or pain during urination. Chlamydia can also infect the rectum and throat, often without symptoms. Any unusual symptoms should prompt a visit to a healthcare professional. Don't ignore these signs. Early detection is key.